Okay, on that note, my minutes are starting. I've been asked to talk about marriage right after lunch. And so, is the marriage working? Well, at IFPRI, at IFPRI, certainly this is a mature marriage. We've been working at this marriage, like all marriages, we have to work at it. And we've worked really hard for more than 3 decades. And you see here publications from all the way to the 80s. Unfortunately, I hear Per Pinstrup Anderson is not here. He has been so inspirational for us, for all of us working in this area. You see also publications from Howdy Buis, Helen Kennedy, Joachim von Braun, etc. So we have been working on this marriage for a long time. Key milestones. We started in the 80s, and I wasn't there in the 80s, like Bonnie. I was still an infant. But Per started by doing excellent work, foundational work really, on conceptualizing why would agriculture impact nutrition and how. He identified, you will notice on the slide, he identified many of the pathways, or if not almost all of the pathways by which agriculture affects nutrition that we now are running with. He only was missing gender on this first phase. After that, we've had some research at IFPRI led by Joachim von Braun and Helen Kennedy on agriculture commercialization. This has been mentioned already this morning, that this was seminal work in many ways, but it did look at what was the impact on nutrition of switching from subsistence farming to agriculture commercialization. And here, what they found was that there was no impact on nutrition in spite of the fact that there were impacts on income. So that raised interesting questions, which the authors themselves had ideas of why that was the case. I also understand that this is when the idea of biofortification was born. I saw somewhere that it was born in 1993, so I imagine Howdy Buis getting up in the morning and saying, we need to make plants, staple crops that are more micronutrient rich. And the idea was born. Congratulations, Howdy. After that, in the 2000, and here I have a long time frame, 15 years from 2000 all the way to now, IFPRI has really boosted its efforts in terms of continuing to work on agriculture and nutrition and health also now. We have invested in a lot of research, partnerships, policy engagement. This is also when we started, along with Howdy's idea about micronutrients and diet quality, we have moved away from thinking just calories. We've moved beyond calories to diet quality. It is not enough to feed people more calories. We need to feed them better diets. This is also a period where we have had the 2020 conference. I cannot read my slides, which is a problem. Could someone put it big? There is a way. Yeah. Anyway, so, and I can't read there either. So we have also invested in evidence generation, and we are still doing that, you know, like the full slide.
The full slide.
Sorry, my minutes are going.
We're going to have someone from AB come.
Okay. So yes, evidence generation. We have invested a lot in filling the gap in knowledge in terms of how we can make agriculture improve nutrition. There's, at the conference, at the 2020 conference in 2010, there was a clear interest and momentum in linking agriculture, nutrition, and health, but there was really not much evidence at the time, and we all complained about the fact that there wasn't much evidence. And since then, we certainly have invested a lot in trying to build a portfolio of research that will answer some of the questions that were then asked. So examples of how we're filling the gaps with rigorous evaluations. A first example is what our work with Helen Keller International. We have been partners with Helen Keller International for quite some time, and we have evaluated a program that they have improved over time. It's an agricultural development program type, which focuses on women and has had the objective of improving women's empowerment from a long time. It also has the objective of improving nutrition and health of mothers and children. And for the first time, we use a randomized controlled trial. We have rigorous methods, and we've shown impacts on children's nutrition of an agricultural development program that was targeted to women. We've shown impact on children's anemia, reducing diarrhea, reducing wasting. So we have really important impacts, and we also find impacts on women's empowerment as well as on women's nutrition and health. So this is just the beginning. We have other case studies like that, but it's the beginning of building a portfolio of evidence on whether or not it works, which was the first question. And this is work from Diana Olney here that I'm showing. We've talked this morning about, actually twice already, about the example from Bangladesh. We had not checked our slides, and I hadn't realized that other people were going to make this, this case study also part of their presentations. But this is an excellent case study where our evidence has led to policy making in Bangladesh. Dr. Ahmed has led decades of excellent research in Bangladesh and has made many different points and many recommendations to policymakers. And they have listened because the presence has been important, and over time we have built trust with the policymakers, and we have the proof today with the presence of Honorable Minister of Agriculture. So 3 things were important here, that Bangladesh is heavily reliant on rice. Poor diet quality is a real problem. Second, women's empowerment is low, and improving women's empowerment is associated with better diets, better food security, better agriculture production. And behavior change, educating people, is important in terms of improving nutrition. Transferring income or transferring or just doing agriculture without educating people about how to feed their children and how to feed themselves is not doing the trick. But with these 3 elements, the Minister of Agriculture has decided that they believe in these results and they want to set up a large-scale intervention in Bangladesh, where they will test different ways of improving diets, different ways of improving agriculture productivity and diversity, and different ways of empowering women. And they will use these results to guide policy later on once we have the results. So this is a nice example of our role in influencing policy. Finally, we have a momentum in nutrition. Nutrition is not just about agriculture, it's about a lot of other sectors, and we have a real momentum there, which has been fueled by the scaling up nutrition movement that David Navarro has spearheaded. We also have the global nutrition reports from 2014, 2015 that Lawrence Haddad has led. All that is happening in nutrition now is a real momentum, and the countries are excited and want to do something, but very often they don't know how to translate this political commitment and these amounts of funding that may be allocated to nutrition. They just don't know exactly how to transfer all this into action on the ground. So we have a project called Stories of Change. It's a project led by Stuart Gillespie that looks exactly at that. It tries to tell the stories using a mix of qualitative and quantitative methods of how countries have achieved results in improving nutrition. The Brazil, for example, even Bangladesh has improved a lot. What have they done, and how can we transfer this knowledge to others to inspire them, to make them want to try these approaches? So this is our Stories of Change, and what we will have in the future, in terms of whether our marriage is working or not, we will have a lot more data to say whether our marriage has an impact or not. And we will have a lot of information by the time we have our 50th anniversary. Thank you.